welcome to today's Health and Medicine, a TV Asia special episode brought to you by Medtronic. I'm Dr. Sachdev. Our discussion today focuses on a disease process which affects the walls of blood vessels, causing them to weaken and dilate, hence posing a serious threat to those affected. To talk more on this subject are Dr. Ravi Veeraswamy, Professor of Surgery and Chief of the Division of Vascular Surgery at the Medical University of South Carolina, and Mr. Daveen Chopra, Vice President and General Manager of Medtronic Aortic based in Santa Rosa, California. Welcome, gentlemen.
Thank you so much.
Thank you.
So let's start with you, Dr. Veeraswamy. For those who are unfamiliar with the term, what exactly do we mean by a vascular surgeon? And what diseases specifically are treated by someone in this area of medicine?
So a vascular surgeon is someone who deals with both arteries and veins, arteries being the vessels that take blood away from the heart, up to the brain, to the arms, and then down to the liver, kidneys, intestines, and then down to the legs. Veins bring blood back from those areas to the heart. Most of our work in the arterial space deals with arteries that have become clogged up or narrowed from atherosclerosis or cholesterol disease or hardening of the arteries. Those are all terms for the same thing. We also deal with what are known as aneurysms, and that's the opposite. That's when the artery becomes weak and starts to balloon out.
I see. Now you mentioned the term aneurysm, and I want to know what exactly do you mean by that and how common is it?
So an aneurysm can be thought of as, say, like a water balloon that's getting filled up with water. The artery becomes weak, and as blood flows through it, it starts becoming bigger and bigger. And as you can imagine, if we don't fix it in time, it can be a problem if it bursts.
Certainly.
It's actually quite a common problem. In the United States, we think there are about 200,000 cases a year,
Really?
and it's the 15th leading cause of death in America. So it's quite common.
So, Daveen, let me ask you this question. What is the prevalence of this disease in the South Asian population specifically? Is there any difference?
Well, South Asians are known to have very high rates of heart disease compared to the general population. And actually in India, cardiovascular disease is the leading cause of death among the Indian population. However, there's still not a lot of information on aortic disease and its prevalence pool, because a lot of patients don't know they have, a lot of people in India don't know they have the disease, and screening is very rare. So there's still a lot of health disparities, and there's very little information about the aortic disease rate in India today.
So aortic disease, from what I've understood, doesn't seem to be as commonly understood as, let's say, heart disease. And doctor, are they related in any way?
Yes, so you're right. There's a lot of focus on diseases of the heart itself. What's interesting is that heart disease and aortic disease share similar risk factors. Obesity, high blood pressure, smoking, a poor lifestyle will contribute to both of these diseases.
Sure.
So in that sense, they are related because they occur in the same patients.
Basically, what you're saying is the patient spectrum is the same, and even maybe some of the risk factors, as you mentioned, smoking, obesity, etc.
That's correct. We don't know, for example, if one causes the other, but we know that both aortic disease, aneurysms occur in the same patients that have heart disease.
Oh, okay. But does it necessarily imply that if a patient has heart disease, existing heart disease, they will be more at risk for developing an aneurysm?
Yes, that's exactly right. And I think it's important for our viewership to understand that if you are at a risk for heart disease, you're also at a risk for aortic disease and aneurysmal disease.
That's a good
and so you
point.
need to be aware of that when you go see your doctor and have that
Okay.
conversation.
Very good point. Also, let's talk about something called thoracic disease. What kinds of conditions do you see that involve the vessels? And when we say thoracic, we're talking about the chest area, correct?
Yes, so as the aorta comes from the heart, when it's in the chest, it's known as the thoracic aorta. And then when it gets down to the belly, it's known as the abdominal aorta. The thoracic aorta can be even more tricky in terms of diagnosis, and oftentimes patients have no symptoms at all. It's something that's picked up on a chest x-ray or a CAT scan that's done for another reason.
And you had mentioned, Dr. Veeraswamy, that aneurysms are a silent killer. That sounds kind of scary to me.
Yes.
Because most patients are asymptomatic,
Sure,
correct?
right. As we discussed,
So-
they have these risk factors.
Right.
But they don't really have any symptoms that are specific to the aneurysm itself.
So how do they know if they have it then?
So there are very specific guidelines for screening that they should talk to their medical doctor about in terms of looking for abdominal aneurysms.
Okay.
And that's something that's a conversation they should definitely have with their physician if they have a problem with high blood pressure, a history of smoking, obesity, and those other risk factors. So
Okay.
screening is an important part of helping prevent the aneurysm from rupturing by diagnosing it early.
Basically, what you're saying is someone may not have any symptoms, but they might be going to their doctor for a routine checkup
Yes.
and have an imaging study, or is
Yes.
it something a doctor can examine and diagnose?
So both of those things, the physician, the doctor can examine the patient and sometimes feel the aneurysm. You can also get a simple ultrasound that doesn't involve any radiation or anything else as a
Okay.
screening test, just to get a yes or no as to whether you have an abdominal aneurysm or not. And I
Okay.
think that's one of the things that vascular surgeons have been very involved in America, is trying to increase screening for abdominal aneurysms, because we're missing a lot of these.
Yeah, as you mentioned, 200,000? Is that
Yes,
correct?
and when you hear about
It's a
someone,
significant number.
Sure, and you often will hear about someone who died in their sleep. Well, a lot of those could
Yes.
be aneurysms that the patient didn't know they had, or their family didn't know they had, that ruptured.
And then let's supposing a doctor, if it's a thoracic case, thoracic aneurysm, as you mentioned in the chest, would there be something that they would hear when they're listening to the patient's heart sounds? Or
No, that gets much trickier to diagnose with thoracic
Okay.
aneurysms because the rib cage is in the way.
Right.
But again, in this day and age, people are getting so many screening tests like chest x-rays, for example, or
Okay.
CAT scans for other reasons, or if you have an abdominal aneurysm, those should be triggers for the patient and the physician to think about looking at whether they need to be screened for a thoracic aneurysm.
That's a very good point. So let's supposing your doctor does happen to find something like an aneurysm. What's
Yes.
next?
First thing is to get overall good medical care. You know, the routine tests that you would get, your blood count, making sure your kidneys function okay, look at your heart, the function of your heart, and so on. But specifically for the aorta itself, we need to get more information about where is the aneurysm, where does it start, where does it end, what's the size of the aneurysm, and generally speaking, a CAT scan is the best way to get most of that information. And that's really what's going to drive the rest of the management as to how we should repair it, should we repair it, what are the options for repairing it, and so on.
Okay, and I do want to talk more about treatment options, and we'll be right back after this short break. You're watching Today's Health and Medicine, brought to you by Medtronic. Stay with us. Welcome back. You're watching Today's Health and Medicine. I'm Dr. Sachdev. Our guests today are Dr. Veera Swamy and Daveen Chopra from Medtronic, and our topic today is aneurysms. Welcome back.
Thank you.
So, doctor, we were talking about, let's supposing a patient goes to their primary care and they're diagnosed with an aneurysm. What next? You mentioned the importance of screening.
Yes.
But what I really want to talk about now are what are the treatment options, or are there any?
If you unfortunately are diagnosed with an aneurysm, it's important to see your vascular surgeon and go through the various treatment options that exist. Luckily, we live in an age where, with great cooperation between physicians, industry, hospitals, everybody involved, we've really increased the ability to treat these aneurysms
Okay.
in a very in a manner that's much less invasive than it was even 10 or 15 years ago. Previously, if a patient had an aneurysm, it involved major surgery. For example, opening up the entire chest, going through the ribs, and fixing the thoracic aortic aneurysm that
Okay,
way. And as you can imagine, that's a lot to go through with a
That
long
is.
recovery period,
And very
dangerous
risky, I
surgery, and
would
very
imagine.
risky. But in this day and age, we can usually go from the top of the leg in the same place that you go to get a heart cath, which patients may be familiar with.
Okay.
Obviously, we use much larger tubes, but you can go through that same spot, go into the thoracic aorta, and put a stent graft. For example, you can see in this model, the white is a stent graft that's come in from the legs into the aorta, and it's located here, and so all the blood will go through the stent graft and will not hit the walls of the aneurysm and take the pressure off of it. You can think of it like a straw inside a cup of soda. all the
Okay.
liquid will go through the straw and will not hit the walls of the cup and take the pressure off and thereby treat the aneurysm.
So what is supporting this right here on the side so that this doesn't bulge out and interfere with this part of the aorta?
Well, let me ask Daveen to comment on that, on some of the technology that goes into these stent
Okay.
grafts.
No, definitely. I've actually got an actual stent graft here that's used.
The actual size?
Yeah, this is an actual one of the larger sizes, but this is an actual size. As you can see, it's pretty large. Some people are
Okay.
surprised about how large this
Yeah, I
actually
never
is.
pictured. I thought it would be thin like a straw, as you said.
And in this, it's actually a fabric tube that's supported by metal stents. So to answer your question, it's actually these metal stents help hold it in place.
I see.
And as Dr. Verswamy is saying, what it's actually doing is taking the pressure off the wall because the blood will now flow through the tube and take the pressure off the wall and stay in the tube and not go against that bulge or that aneurysm.
Okay.
And what these are designed to do is they're designed to be very flexible because everyone's patient's anatomy is very different, but it's usually pretty curved. And we've designed these to be very flexible to conform to your aorta. We also design a delivery system that goes along with it so it's be placed very easily by physicians and be very accurate with where we want it to go.
And is this a standard size or product you would use regardless of the area of the aneurysm, or is it specific to a certain area
Well,
only?
this is specific to the thoracic area, but it is actually one of the larger diameters. But this is
Okay.
kind of a standard product that would be used throughout the thoracic area.
I see. Now, how would you insert this?
So typically the patient does not even have an incision, believe it or not, in this day and age. Most of my work, for example, involves just a needle stick in the groin at the top of the legs.
Okay.
And we have special devices at the end of the case where we can close that hole from inside. And the patient will literally go home the next day with a Band-Aid or nothing and can get back to
Really?
their regular activities. But we go in through the artery at the top of the leg, from inside the artery to the place we want to deliver the stent graft.
And are you visualizing all this on a monitor or
Yes,
something
we have
so you know
X-ray
where you're going?
technology.
Okay.
Yes. We have X-ray technology that helps us
Okay.
see where we're going, and we can use landmarks and make sure that the stent goes in the correct place and doesn't cover, for example, the arteries that go to the brain and things like that.
And how would that, I don't know, Daveen, maybe it's a question for you since you seem to be the technical person here. How does that stay in place? How does it not move here and there, or how do you make sure it's like stuck to that
Yeah, so
particular
it's sized to
wall?
be a little bit larger than the aortic wall. So there's actually kind of a radial pressure. So the force of the stents, which is sized so that it's a little bit larger than the vessel, help push out against the aortic wall and they hold it in place at the front end and the back end. So you've kind of locked it in at the front end and back end with the radial force of these metal stents to hold it in place.
Okay.
You know, Daveen, you may want to tell them about the new endo-anchor technology as well. That might be of interest
Oh,
to your
yes,
audience.
yes.
We've actually recently launched a new endo-anchor technology, as you've said. And in this technology, essentially is a screw that you'd put in endovascularly to the similar technique that Dr. Verswamy talked about from inside of you. And then it helps screw in the stent graft into the aortic wall. The goal of this is to help kind of mimic open surgery where they use these sutures to kind of sew things in, but these screws help
How
sew
big are the
things.
screws?
The screws are only a couple of millimeters long, actually, so they're very, very small.
And they don't cause any rupture or perforation in the
No,
wall
they actually
of the
just
vessel?
go through the stent graft or the fabric and go right into the aortic wall and stay in there, and they help really increase
Really?
long-term
How
durability.
fascinating. And this technology is unique to Medtronic?
This is a unique product we have, the Endo Anchors. It's the Helifix product that's available here in the U.S. today.
Okay, and Medtronic is the pioneer for that.
We are the pioneers of it. It's a great technology.
Wonderful, wonderful. I think we had mentioned before during the interview we did before we went on air, TAAA. Is that right?
Right, so that's
Okay,
a
tell me
thoracoabdominal
what that is.
aneurysm.
Okay.
And so that's along the lines of what we've been discussing. It's
Okay.
an aneurysm that involves both the thoracic aorta and the abdominal aorta.
So if someone has an aneurysm in
Both places, well, that's a major
Or-
league problem.
Oh, okay,
And you really
okay.
need to have a very specific discussion with your vascular surgeon
I
about
see.
what the options are.
Okay.
But there's one other thing that we should talk about, which is a dissection. So
Oh,
in addition to having this ballooning where the aorta balloons out like a water balloon,
Mm-hmm.
you can also have a separate problem. Although the aorta looks like it's just one tube, it's actually composed of several layers that are glued together when in you and I and everyone else. But some patients, for reasons that we don't know but may be related to high blood pressure, those layers can become separated. If you can imagine saran wrap stuck together,
Yes.
and then blood somehow gets between the layers of saran wrap.
So it's
and
like peeling
That's
apart.
correct. It peels and tears all the way down.
Okay.
That is a situation known as a dissection of the aorta.
Okay.
Typically occurs in the chest, that's a situation where the patient will have symptoms. They will have significant, unusual back pain or chest pain. It's unlike anything they've felt before.
How does that happen, though?
Well, we don't completely know, but we know these patients always have high blood pressure when they come in. And there are a variety of other things that can contribute to it, some genetic components. Sometimes they can have calcium in the aorta itself, but high blood pressure seems to always be at least part of the problem.
Can there be some hereditary disorders,
There can
like
be.
involving the collagen production or vascular
Yes,
disorders?
you can have collagen diseases such as Ehlers-Danlos or Marfan's,
Oh, okay.
and that's actually a small percentage of patients. But if
Okay.
you're a otherwise healthy person, you think you're doing fine, but you have high blood pressure and you have sudden
not
chest,
controlled.
yes, it's a real problem. So when dissections occur, we are also treating those by using stent grafts such as this, putting them inside the aorta and pushing those layers back together to help
Oh, I
recreate the normal
see.
aortic
So
anatomy.
the same device is used for two different
That's
conditions.
correct.
And functions the same way?
That's correct. As far as we know, this is it's an area in evolution. We're trying to get more data, but really the only other option is to do open surgery, and that's really not a good idea when you have dissections.
Now, I had seen some cases, when you hear about this dissection, now it's triggering a memory for me that people who are in car accidents or who have sudden trauma to the chest or even to the abdomen, they are at risk for
Yes.
developing this.
Yes, if you're in a severe car accident, you can actually tear the aorta in the chest. That used to be, again, as recently as 10, 15 years ago, a life-threatening problem because
Certainly.
obviously these patients have other injuries and operating on them is not easy to do.
Right.
But today we can go in and put a stent graft and stabilize that area either temporarily or permanently and really help save a lot of lives in trauma.
And how's the recovery time? I know you had mentioned traditionally you were doing open kind of, I don't know if you call it open heart or open chest surgery.
Yes.
Is there a difference in recovery time?
Yes, with the traditional open surgery, patients would be in the intensive care unit alone for several days, be in the hospital for a week, 2 weeks, if not longer,
Okay.
with all the complications that may occur with those sometimes. And it was a long recovery back. Really now with the endovascular techniques, and patients are going home, as I mentioned, in a day, 2 days. It's really been a revolution in vascular surgery.
Have you seen any risks or complications from endovascular?
Of course, nothing is a free pass, and so we have to follow these patients long term,
Okay.
over months to years, to make sure, as you were asking, that that the pieces of the stent grafts are not moving,
Certainly.
and that they continue to function in the way that that they're designed to function. But we've really had good results with them long term. There can also be other complications of where we go in at the top of the
Okay.
leg.
Okay.
There can be complications of accidentally covering some arteries that we didn't want to cover.
Right.
But if you go to a good vascular surgeon with a lot of experience, those should be fairly
Yes.
minimal.
And then with the open technique, I guess you still use a stent and all, or do you do something entirely different?
No, it's entirely different. With open techniques, you're replacing
Actually-
that part. So you remove that part of the aorta and physically sew in a piece of fabric
I
with
see.
stitches.
So it's repairing. a
That's repairing, yes,
process.
that's correct.
And we are going to come back and talk a little bit more, so don't go away. And our viewers, please do stay with us. We are talking to Dr. Veera Swami and Daveen Chopra from Medtronic. And we want you to stay tuned because we have more information. Welcome back to today's Health and Medicine. I'm Dr. Sachdev. We are talking about aneurysms with Dr. Veera Swami and Daveen Chopra from Medtronic. I had read a little bit about the political, societal area of life, and it seems that they had suffered from aneurysms and actually died from it. Is that true?
That is true. There are a variety of famous people who have died of both of aortic disease, of both aneurysms as well as dissections. Some famous people include Albert Einstein, who died of a AAA, John Ritter, who died of dissection, Lucille Ball,
Oh,
Alan
really?
Thicke.
Oh
And
gosh, these are
actually-
some of my favorite people.
And there's actually
Oh.
a belief that India's first prime minister, Nehru, may have also died from aortic disease. It's not confirmed, but there's a belief among some people that he also died from
And
that.
in most of these cases, did they just not know they had it? And as you said, they died in their sleep?
The variety of the time, yeah, a lot of these people died from either sudden dissection where they felt the pain and then unfortunately passed away, or a ruptured aneurysm where they never knew they had it and it
And
ruptured.
maybe at that time there wasn't as much awareness.
Much less so back then as there is today, but there's still a lot of awareness to go. There's still many people who don't know about disease, including both primary physicians as well as patients. So there's a huge opportunity for awareness.
And you think that's because the disease isn't as common as what, let's say, like we mentioned, cardiovascular disease, diabetes, these things, cancer, these are far more common in the general population.
Well, let me comment on that. I think a lot of it is just lack of focus on this disease process. When you think of 200,000 cases a year, or the 15th leading cause of death, that's a widespread
still a
problem.
significant
It's a
number,
significant
yeah.
problem. It's just has taken some time for the public and the medical community to understand that these issues are out there. I actually think part of the problem is that until recently, we didn't have solutions that we could offer patients. So
see.
as the solutions have become easier with endovascular technology, it becomes more important to screen people because we have something
Certainly.
that we can do to help them.
Well, it's always been hard traditionally. If you look at AAA disease, it's asymptomatic. You don't know you have it. You have the silent killer, but you don't feel any symptoms.
Sure, good point.
One of the things I should mention is that in one of the rare episodes of bipartisanship in this country, when a person joins Medicare, if they've been a smoker, screening for AAA is now included in your Medicare entrance examination for free.
Oh,
And so
really?
that's another attempt by the vascular surgery community in partnership with everyone else to help people get screened. So if
Okay.
you're joining Medicare, at your entrance examination, you should ask your physician to make sure that if you qualify, you get screened for free for an abdominal aneurysm.
And when you say qualify, what are the factors which make
So once you're
Okay.
at the age where you're entering Medicare and
Sure.
you have a history of smoking, you will qualify for that
okay?
screening.
Or if someone, let's say, has a family history.
That's correct. You have family
then-
history, and obviously if you feel a bulge on physical examination and so on.
This disease is just, I'm bewildered just to know how many people can be affected yet not know they have it. So what can you tell our viewers out there? What can they do to reduce their risk and prevent it?
Yes, so the important things for the viewers to understand are that lifestyle modification or reducing your risk factors is really the most important thing that you can do as a patient. So, as soon as the show ends, get off your couch, go for a walk, quit smoking, lose weight. Those things are important, and over time they
And that
make a
includes
difference.
three of us,
That's
right?
Exactly, we've got to go.
Exactly. So that's the most important thing that you can do as a patient. In addition to that, being aware that this is a possibility should lead to a conversation between you and your physician to see if it's appropriate for you to get screened.
Okay.
Number 3, find a good vascular surgeon in your community who can help you work through this process and get better diagnosis, better imaging, and understand if you need to be fixed or not. There are a variety of resources, including the Society for Vascular Surgery website that patients
Okay.
can go to and get free information that's really centered for patients, not for doctors,
Okay.
which can be very helpful. And then the last thing to know is that endovascular technology with these stent grafts has really revolutionized the way we manage these problems. I get a fair number of patients who say, well, I'm too old to get surgery for my aneurysm. I don't want to go through that major surgical procedure. And they don't really even understand that we can do this in a minimally invasive way and they can be home in a day or two. So that's the last point that I think it's important for all the patients to understand is that you have treatment options that are really quite good these days, and we can get you in and out with very little setback in terms of your quality of life. And in fact, we can improve your quality of life because the aneurysm is now fixed and you're not worried about it.
Okay. And Daveen, any last words for our viewers?
Yes, as a potential patient, I think it's very important to be informed. As Dr. Veeraswamy said, there are a lot of resources on the internet. There's nonprofit organizations like Aneurysm Outreach. And additionally, and they've got a lot of information on their website all about the disease state. And finally, you can go to Medtronic.com, where you have a lot of patient information about the disease states and the therapies that treat it. Being an informed patient is key.
Great to know. Great information. And thank you so much for flying from such long distances to be with us here at the TV Asia studio in New Jersey. We really appreciate your time and your invaluable information.
Yes, thank you for having us.
Thank you.
And
Appreciate
thank you to our viewers for watching today's Health and Medicine. Thank you for being a part of our family here at TV Asia and for watching and staying tuned to our updates on health and medicine as we bring you the latest in this technology and in this field. And we hope to see you again, so please do stay tuned for another episode. And I'm Dr. Sachdev signing off and wishing you well.